explore contributing factors for why people develop shoulder pain that continues to persist or flares up every time they try and add back in some of their favorite lifts. So this is a side view of our skeleton. We can see that we've got our shoulder blade here in purple, and we've got one of the muscles that attaches to the front of the shoulder blade here, which is our pectoralis minor, or our smaller pec muscles. We do have some other muscles like the short head of the bicep, as well as the coracobrachialis, that attach to that area as well, that aren't necessarily visualized here. But for the purposes of this video, you'll be able to get a good visual of what happens to a lot of our weightlifters, especially when we end up doing too many exercises that work the muscles on the front of the shoulder, things like bench press, flies, bicep curls that are in excess of the number of exercises that we're doing for the muscles on the upper back and the back side of the shoulder. And we'll be able to visualize that here in just a minute on our next visual. But I want you to really be able to see what happens whenever these muscles get overdeveloped, or throughout the course of the day, we're hunched over our phone, we're sitting for an extended period of time in between working with clients. We end up getting increased tension, increased pulling force on the front side of the shoulder blade there. And that can end up resulting in postures that look more like this one on the left side here, where that shoulder blade tips forward versus where we should be at more of the time in more balance, as we can see over here on the right. So if we do zoom around back over here onto our visual anatomy here, we can see that the muscles on the back side of the shoulder here, we need to do enough in order to keep enough resting tension in these muscles and enough support from some of these muscles on the back side of the upper back and the shoulder. Muscles like the middle part of the trapezius, the lower part of the trapezius here. And then if we deselect those guys, we can see underneath those muscles, we've got other muscle groups that are deeper, like the back side of the rotator cuff. We've got our infraspinatus and teres minor, and then our rhomboid muscles in through here. And when we've been neglecting those muscles, not balancing out the number of exercises that we're doing for our upper back relative to the muscles on the front of our chest, again, like our pectoralis minor, where we can actually see here our bicep short head that'll attach to the front side of the shoulder blade there, along with this really small muscle here, the coracobrachialis. So if we fade the other ones, we can see how that attaches to the front side of the shoulder blade there. And those muscles can contribute to that forward tilt that we were seeing here, again, on the left side. And when we're in that position for an extended period of time, or when we go and try and perform lifts that require more balance from these muscles on the back side of the shoulder, what ends up resulting in a lot of those cases, we can add our muscles back in and get rid of that fade. What ends up happening here is that a lot of these structures on the front of the shoulder, if we can reposition here a little bit, then we end up getting increased stress transferred through a lot of these structures on the front of the shoulder, which can lead to inflammation and irritation in the short term. And in the long term, if not corrected, can end up resulting in things like arthritis